Okay, so I am talking today about vaccine stewardship and accountability, and that is really what happens to the vaccine once it is in your clinic. And there's different ways of answering that question. One of them would be about how you store and handle the vaccine. So that's not really what I'm talking about. I'm talking about the other side of it, how you track the vaccine once it's there. So I have this picture because when I first had kids, I remember them coming home when the stork brought them. We've been expecting the kids both times for quite a while. And especially with the first one, we had been preparing and preparing and preparing for the birth. And then the birth is over, and you take the kid home, and you have to figure out what to do with it. And I felt completely unprepared for that. It was a chaotic situation because we had focused on the getting it. And so I wished I had known more about what to do with it when I got it home. And so that is kind of the goal here. So vaccine stewardship when you hear that term, you may get a feeling, as is expressed in this famous Edward Manet painting. But I think that we can work together to get to a feeling more like this. So what is vaccine stewardship? Well, it's the law. It is the inventory management of vaccines happens in Alert IIS, that staff are trained, that your inventory in Alert gets reconciled with reality before you order, and that all immunizations are reported to Alert within 14 days of when they are given. So the inventory management in Alert IIS, put it in Alert, it being both your state supplied and privately purchased vaccines if you're participating in a state supplied vaccine program, and keep it honest in Alert. So vaccine inventory management means you're adding both, that more than 95% of the doses are accounted for in Alert. So a valid eligibility code for each immunization given, and the doses are interacting with the inventory so that when you give a shot and it's reported to Alert, Alert is aware of that lot number and can adjust the amount in stock based on the vaccine that was given. And then that if there are discrepancies, that those get reconciled in Alert. The accepting electronic transfers when OIP sends vaccine to you for the Vaccines for Children program or 317, that you accept those when they come in electronically so that they're in your inventory, and that borrowing is a rare occurrence and doesn't happen with flu, at least privately purchased flu. And that is sort of a special rule the CDC thinks is important, and is important because you can't really, it's harder to pay it back because of the seasonality. It's always coming to an end and then a new season starts. And so it's much more confusing if there is payback to be done with one product for another. What about the staff training? Well, every year, staff at every enrolled site have to take trainings. There's every year trainings, which are taken by the primary and backup vaccine coordinator. And there are every other year trainings, which have to be taken by any two staff who work with vaccines. However, all the staff working with vaccines should be trained, just it doesn't have to be through our online module, which can be reached here. This is a live link and you'll get the slide. So if this looks unfamiliar to you, you can find your way there. So reconciling inventory prior to ordering. What's in your fridge, this is an industrial scale fridge, should equal what's in your computer. If they're not the same, then you will adjust what's in your computer. And you would adjust it using these receipt of inventory. You've got new stock, error correction, doses returned, doses transferred, doses recalled, doses administered, borrowed in, borrowed out, spoilage, lost, failure to store properly, refrigeration failure, lost or unaccounted for in provider inventory, and not usable reported by writer. So those are reasons why you would adjust your inventory other than giving a shot. And all immunizations have to be reported within 14 days. That used to be a bigger deal. Now, if you are working for a site that uses, that does the user interface, so you're entering the shots by hand, this may still be a bigger issue for you. Or if you're doing off-site clinics, where you're going out somewhere and you're having people fill out paperwork and then you're coming back and entering it into alert afterward, that might be an issue. But with the data exchange that was talked about in the last presentation, that is not usually a big issue. Usually now when we find that there's a problem with things getting in within 14 days, it's not because people aren't doing what they should do. It's more often because there's some problem with the computers talking to each other. So as promised, it is the law. So this is what I shared in the chat earlier about providers who participate have to administer immunizations, and pharmacists must report. And then somebody was talking about HIPAA in the chat, and you'll see here number 4, any authorized user may report immunizations and other such information as prescribed by the program to the IIS without consent of the client or the parent or guardian of the client, and that person shall not be subject to liability or civil action. So if you ever wondered, how is it we can just give this information without having somebody sign a form, a release? That's it. There's information that has to be given, and users who give stay supply vaccine have to use the inventory. So vaccine accountability, where did the vaccine go? Well, more law. Any entity receiving state supplied vaccine shall account for all the vaccines that it administers through data submission and inventory management. And then number 2 says, if you're getting state supplied vaccine, you can transfer it to another state supplied vaccine enrolled clinic, but you can't transfer it anywhere else. So this guy is a great entertainer. He has a perfectly white shirt and teeth that match and eyes and a rabbit in his hat. And how it got there is a total mystery. It's amazing and it's dazzling. But that's not what we want for the vaccines. So what is a vaccine accountability? One is you in the clinic know where the vaccine went. So this guy is dealing out 3-card Monty. There's going to be a coin or a ball under one of these cards, and someone's going to try to guess which one it is. The dealer knows. The person on the other side is going to have a very hard time figuring it out, and it's probably not there at all. Someone else can tell where the vaccine went. So you or know, and somebody using alert can look and figure out where it went. And where the vaccine went was not waste, expiration, or spoilage, and not to the wrong patients. So we'll get to all of that. So where the vaccine went. This is the accountability report, which any super user can run, and you'll see it talks about where the vaccine went. If you look at these columns that are highlighted, doses reported, those are shots that are reported to alert and subtract from the alert inventory. Then there's expired, spoiled, wasted. Those come out of those codes we were looking at in that manual adjustment page a few slides ago. Doses transferred out, the ones you send to another enrolled clinic, and then you're starting and ending inventory. But not on that report are error correction, doses administered, lost or unaccounted for in the provider inventory. And so a non-accountable use isn't necessarily a bad use of the vaccine, It's just a use where it's hard for somebody to look and see what happened to it. Instead of linking directly to a patient record, a dose administered means that you modified the inventory by hand. You went into your alert inventory and you counted your fridge and you said, oh, alert thinks we have 32, but we have 30. But we know those were given to patients, so we're going to take 2 out of alert inventory. That's totally fine. It's acceptable. It's what you're supposed to do, but it shouldn't be happening so much that it's hard to figure out where the vaccine is going. Error correction, same thing. It is for when something happens in alert inventory that isn't real. You add 10 doses and then you realize, oh, that box only has 5. So then you subtract 5 by error correction. It's an error because you never had the 10. You only ever had the 5. And then lost or unaccounted for, it's kind of obvious why that wouldn't be an accountable use. Now, there are uses of vaccine that aren't good, and they're not necessarily the same ones, right? Spoilage, loss and damage, failure to store properly, etc. So others can tell where the vaccine went. Back to that same report, and this is an old one. It's exactly the same now. So if I were to try to figure out what's happening to the vaccine, and the reason that we care about this is because our job is to make sure that the vaccine paid for the taxpayers that goes out through our program to clinics to be given to VFC eligible kids and 317 eligible adults is being used that way. And so when there is accountable use of the vaccine, it's much easier to see that done than if the use is not showing up in this report because you're putting a lot of doses administered or error correction. We can still usually go in and figure that out, kind of deduce what happened. But we can't do that for every clinic. It's too time consuming. And so it's important to have clear use. So like in this case, here's how this report works. This line that's in bold is all of these Tdap vaccines. And above it are all the lot numbers of Tdap vaccine that were in stock during the time period chosen for this report, which was month 7 and 8. So we can see at the beginning of that month, there wasn't any. At the beginning of the time period, there wasn't any. And then 71 doses were received into inventory. Great. So how many doses should be accounted for? 71. So 1 shot was given and subtracted from inventory under that doses reported column. None were expired, none were spoiled, 5 were wasted. And then now in stock and alert are 45. So only 51 of them are accounted for. The 45 that are still there, plus the 5 that were wasted, plus the 1 that was reported. And so 20 have slipped away somewhere. It's coincidence that the number received and the percentage are both 71. And so at the clinic, you may have a very clear idea and be able to make those inventory adjustments, exactly what happened to that vaccine, but somebody else looking can't tell. And this is a live link for instructions for how to run that report. So what lowers accountability? Well, those doses administered, lots of adjustments, not sending an eligibility code to alert or sending an invalid code. So every person who is insured by the Oregon Health by OHP can may have Medicaid, but only the kids can use the Medicaid code. So if an adult gets the Medicaid code, alert says that's impossible, and it kicks it out. The same would be true for code A, American Indian Alaska Native. That is a VFC code, so while obviously people over age 18 can be American Indian or Alaska Native, the A code would not apply to them for the purpose of the vaccines. So the goal is to have a transparent audit trail. So what lowers accountability? Well, typos. The lot number is the key to matching what happens in the patient record to what happens in alert inventory. Sometimes the unit of use and the unit of sale, the vial and the box, will have different lot numbers. Usually, just slightly different as kind of a coding mechanism, but in some cases, like prior, it's totally different. So it's hard, I think, for people who have gone through medical training to hear this, but we want you to use the box, not the vial. The box is what's going to be an alert, and when you put that in, it's what's going to interact. Using the letter O instead of the number 0. Lot numbers never have a letter. They only will have a 0. So if you can't tell the difference, it's a 0 in the case of lot numbers. And then if you're entering directly using the user interface, there's a button you have to click that says from alert IIS inventory. And if it hasn't been checked, none of those doses will come out of your alert inventory. So where the vaccine went was not waste. Waste is where you've drawn up the vaccine and the patient refuses after all. Or you drop the vaccine and you drop it on the way to give the immunization. So we don't actually want those. When you return your vaccine, those are the only ones that we ask you not to return among these. We don't want the open ones. Expired, obviously it hasn't been given, but it's gone bad. That's the expiration date that's printed on the vial, not a beyond use date. And then spoiled. Here you can see something has gone wrong and somebody is responsible, as you can see in this picture. That's where you left the vaccine out on the top of the fridge. You took it out, you gave the shot, you put it there for a second. And then the next day you came in, you were like, oh, that was a lot more than a second. Or it gets left, it comes in and somebody's like, what is this box that's been sitting on my desk for the last week? And then, oops, that was the vaccine that we've been looking for. So they will not necessarily lower the accountability number, but they're not great uses of vaccine. And where the vaccine went was not the wrong patient. So who's the wrong patient? What do I mean by that? Well, a patient whose eligibility status is not appropriate for the vaccine funding source they receive. So to know that, you have to know the patient's eligibility status and the eligibility rules. And I think that's really the core of this presentation, is that knowing those rules is absolutely essential to running this program. And for everybody who's making who's giving vaccines at a site, because they have to code correctly and choose the right vaccine out of the fridge is where you have more than one stock to avoid borrowing. So wrong patient. So here it is, chart showing who is, what code is to be used for what patient. So these top ones in this orange box are all for people who are 18 years or younger. So these codes are for VFC eligible. Now down here, for vaccine access program sites like you guys, some of these still receive state supply vaccine. They're just not in VFC. They're for some other reason, 317, or the billables program. And those of you who have been at this for a while, and not even necessarily that long, will remember that it used to be the only one that we didn't supply was flu. And you had to buy flu for your privately insured kids and your adults. But last year, almost exactly a year ago, that changed. So now Varivax and flu, and then if you carry them, MMRV and Pfizer COVID, have to be purchased privately to be given to people who are not eligible for a state program. So who aren't eligible for that M, N, A, F, or O on this chart. So this is a little mock-up of the flu. State supplied flu can go to those top guys. No flu under O or B, vulnerable populations flu, and private flu should be coded L. And then the same for these other vaccines that have been removed from the billables program, unfortunately. So the important thing about those codes is that you're using the right tool for the job, using the right vaccine and the right code for the right kid or adult. And it's kind of a flow. If you know the age and insurance status, that flows into the eligibility coding. And then based on the eligibility coding, there will be consequences for what stock of vaccine you use and billing. So, borrowing. This guy is unhappy, and he is always thinking about borrowing. And running through his mind all the time is his favorite quote from high school: neither a borrower nor a lender be. So, what is borrowing? What is he so worked up about? Well, it's using vaccine from one funding source for a patient who's not eligible for vaccine from that funding source, which is a very dry definition. But here's an example. A person eligible for vaccine through Vaccines for Children 317 or vulnerable populations flu should receive it from state supply. A person not eligible through any of those programs for a specific vaccine should receive privately purchased vaccine. And it says for a specific vaccine because somebody might be eligible for under one, but not the other. And a person receives vaccine from the wrong supply, it was borrowed and must be paid back. So how do you find out about that? Well, you can run, you can go into your alert account, going to manage inventory over here, show transactions, and pick a time period and get a list of transactions that will show these two were received into inventory, 100 and then 50. And then one was given and borrowed. One was given as an immunization, not borrowed, and then another as an immunization. So you can see Liz Brown is an adult, got a state-supplied Pneumovax 23, and it was not called a borrow. And they got a private flu, and it was called a borrow. Does anybody have any idea why that would be? This is a tricky question. The reason, I think, is because that Liz Brown was given this Pneumovax as a billable vaccine. And so the state supply was appropriate. But then when they gave the private vaccine, they didn't use the locally owned code. They used the billable code again. And so then it said that a private vaccine was a borrow for that. That's my guess. So it wasn't a real borrow. It was just a mistake in the coding. Another way to find borrows using the ad hoc report. It's complicated. I'm not going to try to go through it in this setting, but I will show you which ones we would choose from the list when running it. And then there's training. It's the ad hoc list report that you would want to run, not the ad hoc count report. And here's a live link to get some training on that. And what's nice about this, one, if you can filter the information, that's great. The other is that you get not just the borrows, but you also get ones that didn't interact with inventory. So supposing, so this clinic has given these 3 shots. The top one came subtracted from inventory and wasn't a borrow. So that one is just what it should look like. That's perfect. The next one, MMR, was coded locally owned and came out of inventory, but was a borrow because it was that same lot which belonged to the state. And that would have to be paid back. And then finally, this one, 5DL22, when this shot came into alert couldn't find 5DL22 in stock. And so I said, I don't know if it's a borrow, because it doesn't know if it's a borrow unless it knows if it's state supplied or privately purchased. If it can't find it, it doesn't know. And so the ad hoc report helps you find both the borrows and other problems where things weren't going the way they were supposed to. So for you guys, for the vaccine access program clinics, Most often when you find a borrow, it's a coding problem rather than a real borrow, because you're only carrying two stocks for flu, varicella, and if you carry MMRV and Pfizer COVID. Otherwise, you just have one stock. So you're not going to, it's not likely to be a borrow. It's much more likely to just be a issue. So correcting the coding fixes the problem, but you have to correct it both in alert and in your EHR. Is there I see the number of chats has gone up, but I can't see the chat, so I'm sharing my screen. Is there a question?
No, you had somebody answer your question for coding.
Oh, nice. Thank you. So alert will not take code updates via data exchange if the dose is deducted from inventory. So supposing you discover, whoops, we meant to put in code L for a flu dose, but we put in code B because the person had also gotten another shot. We put in, they were privately insured. We put in B for billable for their Tdap, but they also got their flu shot, and we just forgot to change it to L for locally owned. So we got called a borrow. So I'm going to change it to L. You can change it to L in your EHR and an alert, and that fixes it. But if you just change it in your EHR and the dose is just subtracted from inventory, it won't reset it. It won't change it in alert. So you have to do it in both places. There is a fix in the works that would update that so that you could change it, but it is not yet in place. You could change it through your EHR. That's not yet in place. So 317, going back here, other state-supplied vaccine, that is talking about the 317 program. Those are vaccines which are available for people who are too old for the Vaccines for Children program, but who have no insurance. And that is only available from state-supplied vaccine if they meet certain criteria. So you'd go to this chart, and here's the link to it, and you'd find, does this vaccine that I want to give come through 317 program? And if so, is the individual to whom I want to give it, are they eligible based on these criteria? It used to be a bit looser, but it got tightened a little bit because of funding issues, unfortunately. So there's a narrower set of criteria for these vaccines in most cases. And what if there was a real borrow? Then that vaccine has to be paid back to the stock that it was borrowed from. There's 3 steps to this. Track on the borrowing log and give the date of when it was paid back. Move the vaccine itself in the fridge from the one stock to the other, and update in alert inventory so that the dose that you moved is now in alert in the paid back inventory and out of the paid back from inventory. There are lots of resources about this stuff on our website. And I also want you to know that we are always available to answer questions. I think this stuff is super complex, and some people completely have it down. A lot of people are trying to figure it out, and it takes some time and experience to do that. And you don't have to figure it out all on your own. We are always here, and we want to answer your questions. That's our job. And so be in touch. You can talk to our help desk, or you can call me or email me. I'm happy to talk anytime.